Walker is a tireless advocate for HIV/AIDS as Development Director of AIDS Care Ocean State, the largest organization of its kind here in Rhode Island. He is outspoken about his status as an HIV-positive individual and raises awareness and dollars for those who benefit from ACOS. Please welcome my dear friend, George Evans Marley.
Good afternoon, everyone. Good afternoon, everyone. Thanks. I'm so proud to be standing here in front of all of you today on what seems like one of the first days that we've actually had a full day of sun. For those of you who don't know who I am, I'm George Evans Marley. I'm the Fund Development Director for AIDS Care Ocean State. But I stand not only as somebody who is advocating for HIV, but as also someone who has lived with being HIV positive for the last 7 years. For the past 7 years, I've seen both the best and worst of our community. And I'm not going to stand up here and spew statistics at you. We've heard them all before. We know that every year there are new HIV infections in the state. Actually, I'm going to spew a few of them. We know that the number of people living with HIV is growing in our community because it's not a death sentence anymore. We know that there are more people requiring resources because they're not dying, which is a great problem to have. We all know the safety of condoms, so I'm not going to preach that to you, but there are some over at the tent. There are some at the tent if you would like them. And most importantly, that HIV is not just a gay disease, but it affects everybody in our community. And more so are in people of color who are having sex, men who are having sex with men. They are the most at risk and the most marginalized, and the people who would need our resources the most. I proudly stand here representing AIDS Care Ocean State because we are in the community every single day, providing the more resources than any other organization dealing with HIV and AIDS. Over the past year, you've heard me and many other community leaders talk about AIDS Care Ocean State's Encore Syringe Exchange. And in case you've been living under a rock, our Encore Syringe Exchange meets our clients and our community members, our friends and our family members where they are. We meet these people, and not just clients, not customers, not patients, but people like you and I. We're meeting them in the streets, we're meeting them at their neighborhoods, and we're meeting them in their homes. And not only do we provide them with free clean syringes to IV drug users, but so that we can stop the spread of HIV in our state and Hep C, but together we're doing our part to educate our community about the safest way to partake in some of the riskiest behaviors. We understand that not having adequate stable housing, having addiction and recovery be a part of your life, not having access to free mental health and dental care, not having enough money to ensure that you have the resources that you need to survive and have a full life. We understand that all of these are factors in the new rates of HIV infections. And that's why AIDS Care Ocean States exists. We're able to supply our community with those resources because we have a deep understanding of what our community needs. For over 30 years, AIDS Care Ocean State has been providing these resources, and thank you to people like Paul Fitzgerald, who brought this agency up from the ground up when he realized that there was a need in our community. Regardless of who comes across our doorstep, whether it's race, religion, personal philosophies, sexual identification, gender identification, and everyone from all walks of life are human, are part of our human spectrum, and we are here to support them, whatever they need. So last year, Nicholas Mattiello, who has a really comfy seat in this house, yep, feel free to boo, I'm okay with that, cut $65,000 from our Encore Syringe Exchange. The Department of Health calls our Encore Syringe Exchange one of the #1 resources in our state to end the spread of HIV infection. And then they cut our funding. Isn't that nice? But I'm so proud to be part of this community and to be part of Rhode Island, regardless of people like Nicholas Mattiello, who a cis white man and a Republican gets to make the decisions for us about how we're able to live our lives and the resources that are made available to us, and that's not okay. And our state took charge, our voices were heard, and I'm really glad that I'm able to announce today that our syringe exchange has been fully funded once again. And it's people like our Department of Health who understands the needs of our community, and our community itself. Countless drag shows and support from people like you are what has made our syringe exchange alive again. So thank you so very much for that. So along with those good news, we mentioned earlier that some of the issues that we run into are lack of affordable care, lack of housing, lack of access to those resources. And this year we've also been awarded a handful of new grants that are going to allow us to open up 70 new housing units to people living with and affected by HIV and AIDS. So not only are we helping reduce the infection rate, but we're also helping the people who are infected with HIV live a full, healthy, and better life. And it's only because of all of you and your voices and your dedication to our cause and our organization and to your own well-being that we're allowed to do that. So thank you so much for all of your support. Please continue to support each other. And thank you so much for being here today.